Junior doctors in England have voted yes to further industrial action. So before the Prime Minister and the Health Secretary start running around UK news shows, let's get some facts straight.
When it comes to the issue of pay, we have accepted in full the independent recommendations of the pay review bodies.
By now, even Larry the Cat knows the government tells them what the budget is, and given the recommendation was little more than a crappy real terms pay cut, it's not exactly a surprise the Prime Minister is calling it
a fair deal.
And remember, that's on top of the massive 26% real terms pay cut junior doctors have suffered since 2008.
So, today's offer is final. There will be no more talks on pay. We will not negotiate again on this year's settlements, and no amount of strikes will change our decision.
Let's be clear. What the Prime Minister is saying is that if junior doctors won't accept little more than a crappy real terms pay cut, he's just going to impose it on them anyway. Well, absolute bollocks to that. Imposition is not a negotiation, it's bullying and it's intimidation, and that's just not how we do things in this country. And if that's not appalling enough, if they refuse to bend to his demands, he plans to strip them of their democratic right to strike, force them to work against their will and allow them to be sacked if they refuse. Is there any wonder they're angry?
Look, the most important thing we can do to help people is to control inflation. We've got to reduce inflation. And a big part of how we are going to grip and reduce inflation is by having restraint when it comes to pay settlements.
It's just complete bollocks. If a private sector company increases its wages, yes, that goes directly into the cost of making that product or service, and that might end up increasing the price. But that's not the case with public sector workers such as healthcare, which are free at the point of use. That means consumers don't pay for them directly, so they don't affect the inflation statistics.
What we've seen actually is that our plans were beginning to work. Ambulance and waiting times down from an hour and a half over Christmas to around half an hour. Virtually eliminating the number of people waiting 1.5 years for treatment. Making huge progress on GP access. Now all those things, all those plans we put in place, all the funding, all the extra ambulances, the extra discharge, all starting to make a difference. All held up by one very simple fact. Industrial action in the NHS.
It's absolutely shameful. Imagine working in our NHS and having to listen to that bollocks. Hospital waiting lists are the result of a decade of underinvestment by this government, which has left the NHS with too few staff and too few beds. How have we forgotten so soon the sacrifices our junior doctors made to keep us safe during the pandemic? The entire country should be rising up in outrage. Our junior doctors have always been there for us. Now let's be there for them.